An aneurysm is a bulge or swelling in the wall of a blood vessel caused by a weakness in the vessel wall. This weakness allows the blood pressure to push against the wall, making it stretch out. Over time, the aneurysm can grow larger, and if it becomes too big or if the vessel wall becomes too weak, it can rupture, causing serious, sometimes life-threatening bleeding. Aneurysms can form in any part of the body, but the most common locations are in the brain, cerebral aneurysm, the aorta, aortic aneurysm, and the legs. Aortic aneurysms are especially concerning because they can go unnoticed for years since they don't always cause symptoms until they rupture. There are two main types of aortic aneurysms: abdominal aortic aneurysms, AAA, and thoracic aortic aneurysms, TAA. Abdominal aneurysms occur in the lower part of the aorta and are more common in older adults, especially those who smoke or have high blood pressure. Thoracic aneurysms occur in the chest area and are less common but still dangerous. Cerebral aneurysms, also known as brain aneurysms, are typically found in the blood vessels at the base of the brain. Most aneurysms don't have symptoms until they rupture, which is why they can be difficult to detect. When symptoms do occur, they depend on the aneurysm's location. An abdominal aortic aneurysm may cause deep, persistent pain in the abdomen or back. Thoracic aneurysms might lead to chest pain, difficulty breathing, or coughing. A ruptured brain aneurysm often presents with a sudden, severe headache, nausea, vomiting, neck pain, and possibly loss of consciousness. Because a ruptured aneurysm can cause internal bleeding, a stroke, or even death, immediate medical attention is critical. Diagnosis often happens through imaging tests like ultrasound, CT scans, MRIs, or angiograms. These tests help doctors locate the aneurysm, determine its size, and assess the risk of rupture. If an aneurysm is discovered early, doctors may monitor it with regular imaging tests to track its growth and determine if treatment is needed. Treatment depends on the size, location, and risk of rupture. Small aneurysms may not require immediate treatment, but should be closely monitored. Larger or growing aneurysms may need intervention to prevent rupture. For abdominal and thoracic aortic aneurysms, surgery is often recommended, either through open surgery, where the damaged part of the vessel is replaced with a graft, or through minimally invasive endovascular surgery, where a stent graft is inserted to reinforce the weakened blood vessel. In the case of brain aneurysms, surgery or a procedure called endovascular coiling may be used to prevent rupture or treat a ruptured aneurysm. Preventing aneurysms involves managing risk factors, such as controlling high blood pressure, quitting smoking, and maintaining a healthy diet and weight. Regular checkups and imaging tests may be recommended for people with a family history of aneurysms or those at higher risk. It's important to seek immediate medical care if you experience symptoms that could suggest an aneurysm, such as sudden, severe pain or neurological changes. Early detection and treatment can make a significant difference in preventing the potentially life-threatening consequences of a ruptured aneurysm.